So the goal of DAWN has always been twofold, to provide really good patient care and also to expose students to primary care and potentially have them fall in love with a specialty that in my opinion, think is underrated, but extremely important.
DAWN came from two places. I think it came from people not having health care, or people not knowing how to use their own or what they should be going to the hospital for versus primary care.
Patients in the community, especially here in Aurora, have 1,000 barriers to their health, and most of them are not health barriers, they're socioeconomic barriers that have to be addressed first in order for patients to even start thinking about their health. Things like transportation or work or enough food or babysitting, those are things that I think traditionally healthcare providers don't really address or think about, but here at DAWN we make it a priority, especially through our care coordination work group, to really do the best that we can to address all those other barriers to make it as easy as possible for the patient.
We're looking at the social determinants of health and saying, okay, if you can't afford to pay your electricity bill, you might get cold during the winter, and that can lead to you getting sick more often, or you can't pay for your medications. So it's great, now we're acknowledging, okay, that's a component of health. But us sort of coming in and saying, oh, hey, you can't pay for your meds, now we know that's a thing, it's not enough. So we need to be able to address things like that. We need to be able to help people pay for their medications and help them, give them sort of a little bit of security so that it's not just them being okay when they're in the DAWN clinic. They need to be okay the other 6 days of the week when they're not here.
We really try and include everyone's strengths. Our pharmacy students really work with meds, and they work with the med students to make sure that those meds are good for those patients. Because everyone here is learning, and we all know that we can learn from each other, and that we have something that we can teach other professions. Nursing students can teach other professions about different cultures and different competencies and how to teach our patients. Whereas, med students can teach the nursing students about a certain medication or a disease process. So by being able to teach each other and to learn from each other, we're getting an experience here that is not offered elsewhere.
We had a lot of big benchmarks saying, like, tonight we're seeing our 100th patient, or now we've been operating for a year, and we keep hitting things like that, and those are always cool. The thing that was really cool for me was seeing people accept DAWN almost as like, oh, of course we have a student-run clinic. It'd be trying to go out and do these recruitment events, and before I'd be like, have you heard of DAWN? Have you heard of DAWN? I get a bunch of blank stares. People are like, yeah, no, I know DAWN. Everybody knows DAWN. And seeing that change over a year and a half and 2 years, has blown me away.
I want people to realize that every single individual, every single action, every single donation really, really makes a difference. Here at DAWN, because of the scope of how big we are and really how cost conscious we are, every $100 that we receive, that can be put towards buying a patient an antibiotic that will prevent them from becoming septic and landing in the emergency room and landing in the hospital. And so really, it's small things that really go a long way to making a difference to the patients that we take care of here at DAWN.
At first, when we sort of got DAWN to an operational level, when we got it to a place where we could see patients every week, I thought, that's it, we did it. We accomplished our primary care goal, and we're done. And the longer I've been here, the more I see that this is just one tiny piece in a huge complex problem.
DAWN is so important because not only does it give these patients an opportunity to get healthcare and other services that there was no way for them to get elsewhere, and they can do it in an environment that's non-judgmental and culturally competent, culturally safe. But it allows our students to become leaders, and it allows our students to learn from each other in an opportunity that they would never have elsewhere. So for both parties, it offers a really unique experience. And it's so important that now that we started DAWN, we can't ever let it go away.